to the House.
Madam Deputy Speaker.
I call the member for Udjuru.
Madam Deputy Speaker, I rise to contribute to the debate of the budget estimates of the Health and Environment Committee. In terms of health and ambulance services, what is becoming clearer every day is that this government is losing control of health. While there is no doubt that COVID has stretched the system, we would have fared far better if Queensland Health had not already been a basket case under successive Labor governments before going into the health crisis. For example, in the Redlands, we still have no intensive care unit or ICU at the Redlands Hospital. Redlands residents were not kept safe by this government and still are not safe. For the last 6 long years, the Palaszczuk government has ignored community calls, they've ignored the medical grounds and basis for the work to be done, and they've ignored my calls for an ICU. 6 years calling for it, no ICU. They're the facts. There is not one ICU bed to service 150,000 Redlands residents. Not one bed, one ICU bed to service a growing region of 150,000 residents. The Redlands community was vulnerable and susceptible to the pandemic because of this government's inaction on health. The government members might not like the facts nor the truth, but it is what it is. But the government has been dragged into agreeing finally to an ICU, albeit a small one, but a good start, somewhere in the future. As I said in my budget reply speech, over the last 6 years there has been little state funding to upgrade Redlands Hospital, other than the normal funding to maintain it. This government, for many years, has ignored the health needs of our growing and ageing region. I want to thank the federal LNP for leading the way with their catalytic funding that got things moving on the upgrade. The federal LNP funding got things moving again. The $30 million commitment to the ICU and upgrade and additional funds to the car park. Belatedly, the Palaszczuk government has caught up and agreed to matching funding. The state government now needs to fast-track these projects and not drag their feet and re-announce it on an election eve in 2024. And a bigger ICU will soon be needed. A helipad for island emergencies, as previously promised, is needed too.
Order.
Labor committed to the helipad back when the former member for Lytton, Paul Lucas, was the health minister. In terms of the car park, again thanks to the federal LNP for the funding to get this finally underway. The state government has to now build it, and they are yet to announce what the parking costs will be. And whether any free...
Order, members. Member for Udjuru, you have the call.
And any free public spaces will be removed. In terms of palliative care, we now know how underfunded palliative care has been across the whole state. This has resulted in many terminally ill people suffering needlessly. The LNP government started the palliative care service at Redlands Hospital and boosted the in-home services. We are keen to know what future investment will happen at Redlands Hospital in palliative care, and I encourage the Minister to provide that information. It has also been reported that Redlands Hospital's capacity to undertake adult dental surgeries that require anaesthesia has been reduced, with some patients having to be referred to other hospitals, some hospitals with already extensive waiting lists. Then there has been the Cleveland Satellite Hospital debacle that I mentioned in my budget reply speech. Previous budget documents says the government will build the Cleveland Satellite Hospital. The people of Cleveland took that to mean Cleveland, funny enough. Then another budget said it meant Redlands, and then we find out Cleveland actually equals Redland Bay. The two are entirely distinct cities, just if the government members wanted to know. The government plans for health in the Redlands are a shambles. Then there's ambulance ramping that's growing rapidly across South East Queensland hospitals, and Redlands Hospital, sadly, is one of the worst. In terms of environment, in terms of the committee and estimates, when we look at North Stradbroke Island, the issue of the headlands overdevelopment is still there because of the Quandamooka revolt about it. The Truth Embassy at Point Lookout, and invite government members to come and visit and see it live.
Order, members.
The Whale Centre that will be built on sensitive environmental land. Conservation groups are opposed. The Quandamooka people largely are opposed. Local businesses are opposed. Very few people want this development, a development like this, on pristine and environmentally sensitive Point Lookout headlands. That's why the government only got 6% of the primary vote at the Point Lookout booth. There are lessons there, and I hope they'll listen. The Premier, move the project to less environmentally sensitive land.
Deputy Speaker.
I call the member for Palmerston.